Dear students, now coming to our main topic, that is retropharyngeal abscess. In the last video, we have studied about the anatomy of retropharyngeal space. We understood about its boundaries and its contents. Now coming to its infection that is causing the abscess. So let's discuss. The retropharyngeal space abscess can be divided into two categories, acute and chronic. We will discuss one by one. Acute retropharyngeal space is more common in children who are less than 5 years of age. Why? Because the retropharyngeal lymph node gets atrophied after the age of 3 to 5 years. Okay, so it is more common in child under the 5 years of age group. What are the causes? Uh, there can be penetrating injury or any foreign body that gets penetrated. It can be iatrogenic also, that is after any kind of surgical procedure. Acute or chronic adenotonsillitis can also cause this condition. What are the organisms responsible? Mainly there are bacteria such as Staphylococcus aureus, gram-negative bacteria, and there are certain anaerobes. Okay, so these are the main causative agents. Now coming to the symptoms and signs, how patient will present to us. Patient will have complaint of fever, cough, malaise. Also, patient will complain of sore throat, painful swallowing, that is odynophagia, drooling of saliva. There will be change in voice, that is known as hot potato voice, and also at times there can be dyspnea. Now, what are the signs that a clinician or doctor will elicit on the patient of retropharyngeal abscess? Uh, there will be tachycardia, patient will be febrile, and on examination of oral cavity and oropharynx, there will be a bulge on the posterior pharyngeal wall. Also, patient will present with neck stiffness and torticollis. There will be flexed neck and it will be always tilted towards the affected side. Okay. Also, there will be jugulodigastric lymphadenopathy. What are the differential diagnosis of retropharyngeal abscess? It can be CRAUP, that is acute laryngotracheobronchitis or LTB. It can be acute epiglottitis also. It can be peritonsillar abscess or parapharyngeal abscess. So these are the few differentials of the retropharyngeal abscess. Now coming to the investigation part, what investigation we as a doctor can prescribe to the patient of retropharyngeal abscess? We can go for X-ray soft tissue neck lateral view. Also we can advise for CT scan with contrast, and after the drainage of pus, that is after aspiration or incision and drainage, we can send that pus to the laboratory for culture and sensitivity, gram staining, and also to check for any kind of tuberculous bacteria, that is by the AFB staining. We can also do chest X-ray, PA view, and routine blood investigations such as complete blood count and ESR. Why CT scan is important? It is question many times asked. CT is important to look for any kind of complication or further spread of abscess, such as in form of mediastinitis or lung abscess. That is why CT with contrast is advised. Now coming to the treatment part, advise admission of the patient to the hospital and maintain or secure the airway, establish an IV line and give patient IV antibiotics. We can also give analgesics and IV fluids for supportive therapy, and we have to go for surgical drainage, that is mandatory in this case. There are certain routes. Most common is transoral approach. Also there are few other approaches such as external approach. Again, it has been divided into two parts, anterior approach and posterior approach. In the transoral approach, how we proceed? We give a vertical incision on the bulge over the posterior pharyngeal wall and simply drain the pus and send it for the culture sensitivity and other investigations. Now coming to the second part, that is chronic retropharyngeal abscess. Most of the things are almost similar with the acute retropharyngeal abscess, but there are certain important changes that we will discuss here. What are the important causes of chronic retropharyngeal abscess? Most important is tubercular infection. Okay, it can be of anywhere, but it is commonly seen that TB spine, also known as pot spine, or other causes are cervical vertebrae fracture, and the route of infection can also be hematogenous. Okay, the infection is coming from the blood itself. And what will be the symptoms of chronic retropharyngeal abscess? As the most common cause is tuberculosis, so we will observe an evening rise of temperature that we see in TB also. There will be loss of appetite, there will be weight loss, there will be presence of neck lumps, multiple neck lumps, and mild dysphagia due to abscess. So all these are commonly the features of tuberculosis. uh, in a patient. So similar features will present here also in case of chronic retropharyngeal abscess. Now coming to the examination part, that when we examine the patient of chronic retropharyngeal abscess, we will see there will be presence of matted lymph nodes in the neck, and that will also be tender on palpation. What are the investigation that we can advise in case of chronic retropharyngeal abscess? Basically, we have to rule out the tubercular causes. Okay, so we will advise the investigatory panel that belongs to tuberculosis. So we have to order a Mantoux test. Also, we can go for CT neck with contrast. Indications are already told in previous slides. We can order a chest x-ray. We can go for routine blood investigation, that is complete blood count and ESR. We can go for x-ray neck and lateral view. What are the treatment for chronic retropharyngeal abscess? It is the same that was of acute retropharyngeal abscess, that is drainage of pus. But here we also have to give anti-tubercular therapy in case of TB patients. So as it is seen that most common cause of chronic retropharyngeal abscess is tuberculosis. So the treatment will be drainage of pus with anti-tubercular therapy. Okay, so there is one basic difference here in the drainage of pus. That is, in case of chronic retropharyngeal abscess, the pus will be drained only by the external route. While we have seen in case of acute retropharyngeal abscess, the pus was drained most commonly by the transoral route. So why it is different here? Basically, in case of transoral approach, if we drain the pus, there will be chances of spillage of pus in the oropharynx, and it may also go to the laryngeal cavity. Okay, that may further cause other infections, and also there will be chances of mediastinitis by the transoral approach. Drainage of pus. Why? Because of spillage of pus. But in case of external approach, there will be least chances of these space infection. Okay, so as the most common cause of chronic retropharyngeal abscess we have already discussed, that is tuberculosis. So we will have to avoid the transoral approach for the drainage of chronic retropharyngeal abscess. So we prefer the external approach. That was all about the acute and chronic retropharyngeal abscess. Go through this topic as it is very important from the exam point of view. Anatomy we have already discussed, and disease part we have discussed in this video. Okay, so enjoy learning and subscribe to my channel. Thank you.